Greetings, everyone. Welcome to Macro Social Work Stories, where we're here to hear your story and hear the lived experiences of social workers around the world. As we look at today's topic, we're going to look at working in the pandemic. Macro social work as relates to working in the pandemic, relief services, working with those who are displaced. We know that during this time period, we are having to deal with uh, crises, various predicaments around the world, as well as in North America. Today, we're going to highlight one of our colleagues, Dr. Kristie Holmes, who actually works with the American Red Cross. American Red Cross has a long legacy of service in our society. The American Red Cross is full of numerous volunteers. Over 90% of all of the services provided are provided by volunteers. So if you're listening today and you want to provide a service for those who are displaced or going through a crisis, Red Cross may be the organization for you. The volunteers make up over 90% of the disaster relief workforce. They respond to over 70,000 disasters every year. And so a number of these disasters are apartment fires. So we're going to talk about that on today. And we're going to go around our virtual space, and we'll have my colleagues tell us who they are and one fact about themselves. We're going to start with Dr. Steve.
Well, thank you, Dr. Gary. This is Steve Burkhart in New York City at Silverman School of Social Work. It's great to be with everybody. In particular, I'm really interested in Kristie's presentation today because the level of disaster in New York related to the pandemic. We recently had Ida with the horrible deaths that occurred in the flooding that went on that are supposed to happen every century. And of course, it doesn't seem like it's a century anymore. There was once in a century flood, the once in a century fire. Well, this century, we've had a whole bunch of those. So how we prepare, what we need to do, what we in social work need to do, I'm really interested in having this conversation with all of us. Kristie.
Preparation is the key.
Thanks for having me, guys. I love working with these two. I can't help but already have questions as soon as you talk about New York City, because it's an easy way for us to encapsulate all that's going on right now. I've been doing this since 2017, so not that long, but actually longer than I thought when I looked at this. Red Cross has been around since the 1800s. And when I went into it, I went as a recruited medical team person with several others from USC. And it was a really good experience, but it was definitely jumping in the deep end first. We went for Hurricane Harvey. So sleeping in a arena with snakes, no water. But it was a really good way to learn. So we learned about all of the different levels and jobs. One of the things I wanted to point out, and I know I'll forget later, is that one of the things the Red Cross does very well, especially when the supervisors are trained well, is to make sure that every single person there has a purpose and a job to do. It does not matter what it is, but everyone who's serving is doing something that's crucial to the mission. Otherwise, they wouldn't be there. And I think that's an amazing way to make sure your volunteers feel appreciated and needed. You're never questioning whether or not you're needed where you're at. And I think that's a really important part of a lot of the organizational missions we talk about or teach about in schools of social work, and a lot of times end up being missing once you get into an organization or a nonprofit. And this is one who's been doing it for such a long time. It's really well organized. And just seeing the Red Cross vehicles come into the towns or cities we were coming into brought relief to people psychologically, seeing that help was there. So regardless of any mixed feelings they may have had, Red Cross has had some negative headlines over the years too, especially when it comes to fundraising. But that's a topic for a different way with large organizations and fundraising. But overhead is a huge part of this organization and part of how it runs smoothly. And a lot of people don't understand that. So anyway, when we come into town, it really does make a difference for those coming, knowing that food is coming, shelter is coming, medical help is coming. There's medical teams, nurses. If you have missing medications, all of these things are going to be addressed. And most people know that, at least in an elemental, generic way, even if they don't understand what the Red Cross does exactly. They know that help is here. And they often come in with the first responders or armed forces. to help. So, Steve, when you said New York and the unexpected flooding, really is how I saw the news here from the West Coast.
Yeah.
How well prepared do you feel that the city was for this, and how did it recover?
Well, I think they thought they were prepared. They certainly did a lot of, uh, you know, initial making sure the world knew that this was going to be serious. But it was really not so much about could they broadcast the 2 days before. It was really about how well were they prepared before this all happened.
Yeah.
In particular, um, the number of people who died in the regional area died because of living in unsafe housing conditions where they're living in basements, they're double and tripled up. That all came about because, for lack of resources, the housing inspections, the regulations to make sure that people are living in safe conditions, those resources just weren't there. So the people who died, lo and behold, overwhelmingly in the region were poor, often undocumented immigrants living doubled and tripled up in places they shouldn't have had to live in that kind of danger. So they did a lot of broadcasting the 3 days before, but the problems of infrastructure and the problems that we confront, like the level of flooding that goes on now, where there's not a capacity to hold the water or dispel the water, that infrastructure just isn't able to support the level of intensity, whether it's water or fire, anymore.
Yeah. Yeah. It's
Uh,
interesting how, go ahead.
no, please.
Interesting how when we have different catastrophes or crises, exposure to our structures and I guess the economic inequities in our society are exposed. And so as we go through these different crises year after year, what kind of changes are you seeing provided to those who may be on the low economic status? Are we making changes, or are we a status quo as a society?
Steve, are you going to answer that?
Well,
I'll
I
take a
think
go
what's
after
happening.
you.
Yeah, I think what this showed is it's a great question, Gary. And the way you framed it is really important because since 2020, we know the infrastructure, whether it's healthcare, whether it's housing, um, whether it's education, the inequities that are so systemic at this point. Systemic is an easy word to throw around. At some point, systemic gets to say, "Oh, that's everything." Well, what it means is structure, and the structure means related to housing. The structure means something about education. The structure means something about what's happening in the healthcare system itself that's embedded in its inequity, where people just don't have access. They don't have access to a door to get out of in a homeless in a home. They don't have access to healthcare until they're dying. These are things that we're now all aware of. Well, I think many of us were aware of this before, but I think America's become much more aware of this in a deeper way. And they're relying on the Red Cross as an example. Well, okay, the Red Cross will show up and doing the good work it does with its marketing, with its reputation. People think it's going to be enough, but Kristie, um, that may not be true.
Well, I think part of it too, the resources. So getting back to what Gary brought up in the first place is, for example, when we were there for Harvey, you have to start somewhere. And when all systems are down, which they were, and this is where a lot of the criticism comes in. I know when we came back in for our deployment, we're getting ready to fly out, watching the news was an out of body experience because they were describing something that wasn't, it was about 15% what I experienced or what I saw. And it wasn't that they weren't telling the truth. It was just from a different perspective. One that doesn't really understand the systemic issues that are going on. And so I know on our team specifically, one of the most helpful things we did was go to the mini marts to find out where people were, because we didn't have some of the mapping access that we should have. And not from the Red Cross or anybody else. We just couldn't get the systems up fast enough to use the internet or desktop computers. There was no phone service. There was nothing to connect to. And so if you have volunteers who don't know how to read maps or don't know what the neighborhoods are on those maps, you have a problem to start with. And so we had to start from the ground up and kind of go back to, you know, 5th grade, 7th grade geography type lessons
Wow.
on which ways, directions, roads go, and the unmarked roads, which in rural southern states can be a lot of the population. That's where we ended up having to go, was who would know? Where could we go where we could find out in the timeliest way possible where there are people who might need help? And the mini marts are the place our team particularly found. The people who knew, who ran those registers, knew what roads to go down. They could say, so-and-so's been helped, go down this little road, 3 trees on the left. All of those houses are underwater. And when we're not from the area, we're deployed from all over the place. We don't have any way of knowing what was there. And we got on little boats and we were on top of the houses trying to figure out who was still on a roof, stuff like that. So it's Facebook ended up being probably the most helpful social media because people were posting who of their neighbors still needed help if they got a connection service with their cell phones from their roofs. So it was very patchy. And so a lot of criticism comes the way of those who are trying to respond to disasters with the assumption they have access to information they do not have, and or training they may or may not have. And in that disaster, there was I had never worked for the Red Cross before, so I was learning on the ground with a lot of other people. So the things that if you volunteer for the Red Cross, the good time to get trained for the Red Cross is before, not during. It was a great learning experience and I'm really happy for it, but there were a lot of things I feel like I could have known before going. Is it better that I went rather than not? Absolutely. But if we really want to be serious about making a dent in some of these issues, we have to be training ahead of time. And this is also a thing that I think can pull in social workers, especially who are very micro focused, not necessarily macro. It's the perfect way to see how all of it interweaves with micro, meso, macro, because it's all happening at the same time. And you're working with people one-on-one with emergency psychological aid, just in trying to help keep things calm and get them the basic needs that they need. And a lot of times it's a mop and some Clorox to keep the mold out. Just really basic things, when sometimes we have mental health professionals coming trying to do full sessions isn't really what they need at the moment. They need to be heard, feel safe, and get some Clorox, some trash bags, things that might have washed away. So I could go a lot of directions on this, but one of the things that stood out, and the other thing they do is after you're in the Red Cross, there's a lot of training, overwhelmingly so sometimes, and a lot has been added since the pandemic because things have had to be done differently and more safely, and which requires more people, more space, and it's of course adding a level of complication. But one of the things that stood out on a recent training was talking about how the national level integrating with local communities is a gap. It's, in the way I was trying to explain, we don't know where the roads are, or we don't even know who to ask. How do we have it planned beforehand to go, okay, who's in this local community that I just got deployed to who already knows this stuff and has planned for it? And certain things like mapping helps. If you guys aren't familiar, it's a very simple thing to do, but you can go online, and when the systems are up, you can see actually all the houses that maybe were there before the tornado, before the flood, before the tsunami, and then what is currently there. So you can know something's missing or who to look for. And people at home who cannot deploy for whatever reason, especially in COVID, can be doing things like helping map their neighborhoods or map other neighborhoods just by drawing on top of satellite maps that immediately get beamed down to the people on the ground. So as a little side note, if someone can't do it for whatever reason, get on a plane and go somewhere, they can actually help in real time. And those sort of things are very helpful. But I know here in Los Angeles, we have neighborhood council, which I've volunteered with, and I work for public schools, but we do have within our neighborhood council a disaster response committee for things like this. So who's doing the trainings for fire, like what's important in your neighborhood, in your part of the state? So I know if I asked both of you, and hopefully you'll tell, like Steve just said, New York, they just had flooding. It's not the only issue you guys get, right? And here it's usually fires. We do get earthquakes here, but normally it's not at the level of Northridge, which was quite a long time ago. But we do have the potential for it. So are we planning for it? What happens when the systems get shut down? And where are the headquarters in your city? Where's the nearest headquarters that's federally connected?
Mm.
So things like this that people don't know and they're trying to figure out when things are burning down. So these are things social workers can get involved in many different ways, connected to whatever it is they're doing as their day job. And I think when Gary, you mentioned 90% of Red Cross volunteers, they aren't paid. And I think it really makes a difference for those who are doing it. The upside also of it's volunteering, but in a different way than you volunteer for most organizations. You are not paid for your time. However, all your costs are covered. So you don't pay for your plane ticket to wherever you're getting deployed. All of that's covered, and you're also given a card to cover your basics when you're there. So you are not coming out of pocket. And that's really important for social work volunteers who don't have any money often out of pocket to volunteer plus pay. So I wanted to make sure that was really clear. And a lot of times the boards social workers join also are asking for money. This isn't the case here. So you won't be coming out of pocket on expenses, and you will be covered for travel.
It's really important what you raised about the amount of planning that now has to go on, the type of skills we need. When you think of I know when I think of infrastructure, I either think of a road or a pipe, for water, or a road for better transportation. But it's really so much more. What you just said related to housing, to be able to understand this mapping, which again, social work tends not to think about, although we're going to have Dr. Tom Felke on again to be able to speak about this. It sounds like a skill set that people have to think about what we can bring to this before the disasters occur. In order, we always talk about prevention. Well, this seems like what's the preventive services connected to disaster? It's an interesting area for us to really.
And what are they? What would we say they are without even without being trained?
Yeah.
What is it?
Yeah.
What
exactly.
do we need to do to prevent, let's just go for death in our own household during a disaster? So what disasters do you guys have, and how do you prevent death in your own household based on the disasters you have?
That's a great question. Gary, what are things like in Baltimore? Baltimore may have been spared recent floods or fires, but what are some of the areas that you think are important down there? I say down because I'm up in New York.
Yes. So like New York, Baltimore and surrounding areas is a overcrowding. When we went through the pandemic, many times people talked about social distancing. But if you live in areas where there's no space, can you really social distance during a pandemic? Not having transportation, using the bus, using the train. Every location is really not prepared to implement the mandates that are placed down, that sometimes they may be cookie color. And they're not regional specific in that process. And so I like how Dr. Holmes highlighted how we can prepare now. Where are the headquarters? What is your individual plan? And what is your community plan if something were to happen in that process? Because we know we experience a lot of flooding as well as fires. On a regular basis, I see house fires in our communities. And we're really only look at one agency as a resource when there should be a plethora of services to provide support for families who are displaced. And we don't know for how long. And sometimes it could be faulty wiring. It could be a number of things, but something structure-wise, we could do a better job.
Faulty wiring and smoke detectors, which I know Red Cross specifically does have. It's more of the boring volunteer work, but they go out and they check people's homes and help install smoke detectors. And you can do things like that in your local community, also through other nonprofits who do these things. I know that when we were in Texas and Louisiana, we had a lot of partnership with local agencies and churches. And a lot of times the shelters for Red Cross are within high school gymnasiums or local churches. So there is a lot of community involvement, but a lot of the time it's harder for the local community to respond for the same reason as it was troublesome. Even though I deployed locally once, it was a bad idea because I thought it would be a good idea to go help during the day and sleep in my own bed at night. It was a terrible idea. I was split in 15 directions. So it's very difficult to manage things when your neighborhood's burning down and your own home. So I don't really recommend when you have something happening in your own neighborhood to try to deploy in it. You can be helpful, but it's not best to fully deploy or volunteer in a way that you can be fully present elsewhere. And it gives you a different frame of reference. It's just practicality wise, it's not really possible to do your full ability. Not saying you can't be helpful, you can, but I would only volunteer. They sometimes ask for 6 to 8 hour shifts for certain things or shelter coverage. That's fine, but doing a full deployment for 9 days or what that's for mental health isn't really possible to do in a fulsome way. So connecting that back to communities and organizations, even if you have really great nonprofits who are good at this stuff in your local community, if your community is affected, it's harder for them to be effective if their systems are also shut down, if they are also flooded. So this is why some of the bigger organizations are better able to connect these things. And also why I think that's probably why I pulled out of this last training I did was the national level communications with the local communities, because that needs to be set up before. The very least, even if they don't have infrastructure, electricity, internet, there's already a connection in place. Who do I have to go find? What board members of this who are actually on this committee can help us here? And that would give a head start instead of having to reinvent the wheel every time, knowing something is going to happen in your community and knowing what it may be is helpful. But we've been surprised, right? A lot of communities this year, last 2 years, have been surprised by weather or certain things that are happening that haven't happened before. So I think bring it back in your own home. How are you disaster prepared? Have you done anything in your own home? I know we have a couple go bags. We might have to dig for a while in the downstairs closet. And last year I purposefully moved some of the water to the upstairs, knowing there's an earthquake or something happens or there's a fire. One section may be okay of the house. You don't want everything in one spot. And at the top of the house, it might not be because we're more townhouse style. So thinking through things like that, what do you have downstairs? What do you have upstairs? What do you have in your car if you can't get anything out of your house?
Wow. There's so much of what you just said. But one of them is we shouldn't be surprised anymore. You're really saying we have to be prepared. We have to know that, these once a century fires, floods, and other things are no longer once a century. They may be once or twice a year. And so having that planning, and I think that's an area where social work could do a lot of work in their communities to help people prevent and plan, or to get the Red Cross involved in, like Gary, you were mentioning all the fires that happened in Baltimore. Well, smoke detectors would do a lot to save lives, and for them to be deployed to do that now before something terrible happens. When I say terrible, I mean major scale. Could stop all the small terrible things from happening, which would be great.
Yeah.
You raised something we talked about briefly in planning this session a little bit, that Red Cross itself is confronting a lot of challenges given the enormity of disasters, that there's just way too many. You see with the firefighters, I don't know how anybody in California, these firefighters, I don't know how they can still live, the damage done to them for months at a time at this level of physical exertion. And then the post-disaster, these wastelands that are left of homes completely destroyed. In my lifetime, before the 21st century, I think there was one every 10 or 20 years somewhere. Well, you can handle that, but that doesn't seem to be the case anymore, even for the Red Cross.
Right. And then there's the crossover with the COVID pandemic on top of it, where I saw, was that last week or a few days ago, that National Guard's being deployed to southern states to drive buses for kids
Oh
to go
yeah.
to school. I mean,
Yeah.
that's our infrastructure too. Teachers, bus drivers, people who can't work because they're sick because of the things Dr. Jones is talking about, right? People who live in more crowded spaces are a lot of our workers, are a lot of our essential workers. And they don't have as much space to spread out, so they're more likely to be infected or have less time to go get vaccinated if they're inclined to, and less education on how vaccines work, et cetera, et cetera. So on top of it, we've got more than one thing happening at the same time, which is
Yeah.
making it much harder. And then with the volunteers, even in a huge network like Red Cross, are affected because people don't want to volunteer in person in the same way because their lives are more at risk than they are otherwise. They're already open to taking risks, or they wouldn't be deploying to places that are falling apart or on fire. But it might just be, an inch too far to do all of these things when they have families at home or have their own health risks, So we have to be realistic about what we can provide in our own country when we have so many things going on at once and we're doing so little to prevent it in many places, hoping it'll just come out in the wash or that the rescue is coming. And it may get to a point where there's no one left to send.
Mm.
And this is more death. The same thing with our healthcare system right now. There's no one,
So,
there's no space.
so what do you think both social work schools and say NASW National, as well as the chapters, um, could be doing or needs to be able to, given these changes, do some innovation here? What do you think are some of the most important things we as a field could be doing now?
Well, I think some courses, touch on it, and doing basic training so we have an idea how disaster services work is important. We tend to, as social work, as a field, want to make our own new thing, and I think that's completely unnecessary. The infrastructure is already there, and I keep going to Red Cross because that's what I know. I know there are others, and especially the ones that we've worked with. But I think we should go with the ones who've been around since the 1800s and do the best overall job and support what's there. We don't have to make new things over and over. All the trainings are there. It's ready to go. Anyone with an internet connection can get on board and learn how to do the one thing. If there's just one job. The other thing I want to point out is I personally was recruited for a medical team to do disaster mental health services, but you don't have to do that. Some people don't want to go do disaster mental health. They may just want to feed people. They may just want to work a shelter. They may want to do other things that they don't do all day. Right? So that is perfectly acceptable too. You can volunteer for you can just do blood services. You want to help people donate blood because blood, that's another thing. We've been in huge short supply in our entire country throughout COVID. Blood transfusions. We need blood. And so people can just go to their local spot and help with blood donations. And it's also providing a service for people who are curious about their antibody counts. Donate blood, get your antibody count. There's things we can do that are less stressful. It doesn't have to be so intense, but also extremely helpful. So there's something at every level and a way to stay involved in a macro way and stay on top of what we are obligated to do as social workers on a multi-level platform. It's not just one thing. So I think just course-wise, touching on it is important in our macro classes to be able to connect back to the micro classes. Disaster relief and disaster services, disaster mental health should be headings in our curriculum. I don't care where it goes, but it should be covered throughout. It should be just one of those things we're touching on because it's so frequent now. It's not the thing that happens it's not just a little specialty. It's going to happen in our community during your career. And you could be the person who steps out and helps, no matter in what capacity. And also helping others know how to help. So, and this goes along with a lot of our government macro issues in social work. It tends to turn people off. Like, I don't know how to be an advocate. I just want to be a therapist. And this is another way to integrate that in our macro classes and policy where maybe they're just not interested. This is important. And and it's personally affecting all of us this last 2 years, right? So if it has more of a personal impact, they're more likely to take action. And so if we connect disaster services into our macro programs, it's going to make a lot more impact in our communities. So.
Yeah, I really believe that. Yeah, I really believe that we can really integrate, because I'm a field director at my university, and so I will plan for next year to have a placement at Red Cross or another disaster relief program, as well as integrate into the classroom. I teach several courses, and we talk about crises. When I came through the line, talk about crises. We didn't talk about displacement, disaster relief, just crises. And so we have to broaden the conversation on how to deal with crises. But then after the crises, after after you go and serve, how do you take care of yourself? So what is it like, the training process, or how do they prepare you to when you leave a site? What type of work does Red Cross do for their volunteers?
One of the things I personally am involved in is welcome home calls. They're debriefs, basically. So, and that's part of mental health services. So, and that's for everyone. We connect with those who are affected by the disaster, but we also work with, and that's what's different about our job in mental health in Red Cross, is that we're supporting everyone. So we also worked with armed forces. We also worked with our fellow volunteers, which seems a little strange because all bets are off in the normal way. HIPAA is off. There's different designations for mental health. It's not as we know it, which there's a lot of training right there, is how mental health services works in a disaster. We do not have the same rules that you would have otherwise because they're impossible. But you're not usually giving any sort of mental health support to your colleagues sitting around you in your shelter. But at Red Cross, you are. So you're going around checking on everyone in the shelter who are also providing services. So a lot of what my work entailed was, after we got back out during the day, was going from cot to cot to cot, checking in with each person, seeing how they're doing and what they saw for the day. Not necessarily a long time, but just knowing someone's listening and someone cares. After a while, self-care can be hard on one of those deployments. That's where the big headphones came in. Like Dr. Burkhart's right now, just put them on. I didn't even I couldn't even manage to have any sort of feedback into my ears or listen to anything, but I would just put them over my ears because it was a signal that I was done chatting for the day, because I just needed to be done, but I wasn't necessarily listening to anything. And some people started using cardboard boxes from all of the supply ships, because they're very big boxes for water and food and whatnot, putting them up between their cots. Not necessarily for privacy, but I'm done now. I need to go to sleep. So it started looking very interesting, towards the end of, and 9 days is a very short deployment. A lot of people are there much, much longer. That's mental health or the medical services. Most people on the medical teams have other jobs back home, so they can't do more than that. But the other, like the feeding and care teams, are there for, I think, a minimum of 3 weeks. So you have to learn to take care of yourself and support others. So the training that leads up to it really depends on what you're doing.
Well, one way that our field could be helpful, both agencies and the profession, is to give permission for people to deploy. In other words, if a disaster occurs, that there's a protocol that's worked out that says, you're not going to be docked your pay. You're going to continue to be paid while you go and do this work in this disaster area, because otherwise people can't go. And given the nature of these disasters, these are not, what happens in California or what happens in New York or any place has a ripple effect around the country. And we have to sort of, whether it's the food chain, the transit chain, there's so many different systems that get disrupted in these disasters, that part of the way our field could do this is to allow workers to be able to do it. You can't do it, it can't only be people who are private practitioners going out to do this work. It has to be people who are trained in homeless services, or trained, Gary, like you are, in trauma-informed work. All this kind of, what a perfect thing to be able to go, agency to go from. But the agency has to give people permission to do it without it being an enormous financial sacrifice.
Misinformation has also been an issue, and I'm going to get back to who's left in shelters, as well. I'm sure there's no big surprise to you guys on that. But misinformation, which has gotten much worse since Harvey, really caused a lot of I don't want to say infrastructure, human personnel, like resources, just people's time trying to correct things they were seeing on the news or on Facebook or other things that were simply untrue. And it wasn't really helpful that local news would parrot a lot of the things they would read, because they didn't have any other resource, so there was no connection. So they had to guess what everybody's doing out there. For example, there were, I don't know if it was specifically Red Cross or it was through Red Cross, donations that were given. And it was a few $100s, $500, but extremely important in those communities at that time, so they could go access basic stuff that they just didn't have, clothes, food. But what was being said wasn't true. As they couldn't get it. The funds were being withheld, when the truth was there was no infrastructure and everyone was trying to apply from their phones. Millions of people were trying to fill out the form on their phones for a system that wasn't designed for millions of people to crash the site at that moment. And so there were, the last several days I was there were just lines of people and volunteers having to repeat the same thing over and over. There isn't a deadline. You will get it, but everybody cannot be on at the same time, or just being able to get a signal. You know, 1 or 2 services were spotty and the rest couldn't access at all. And that had nothing to do with any of the organizations donating or the Red Cross. It had to do with the phones. You know, the cell networks were just down. There was no internet. So, but the reports were something else, which scared the community and had them rushing to the sites trying to get direct funds, which wasn't possible. It just, we didn't have internet connection either. And so it was a lot of just repeating the same thing. So a lot of times, I think also in the last training, they re-emphasized the need to make sure there's a public relations person there who can talk to, and some social workers are more gifted at this than others, being able to connect with the local news stations to avoid these things, so that we're repeating the same message from the National Guard, from the Red Cross, from the local news, so that we don't have people waiting in line and taking away. And we can't blame the person coming. You know, they believe what they read and they're feeling very desperate. So it ends up turning into something that it should never turn into, so that there's clear information and clear messaging. And a lot of times things are done, and this happens a lot with the local organizations, but they do not have the infrastructure to support it. And so it ends up being something that's harder on everyone if it's not communicated in a way through all of these channels before we announce or before we say that we can do something we can't actually support yet. So.
Powerful. Do you want to speak to you were going to speak to the other issue about who gets left behind?
Right. And I noticed that here in fires too, because I spent a lot more time in shelters. I was out in the field a lot during Harvey, but last year's fires and the year before here, people who are left in the shelter at the end before the shelter itself closes down and are required to close down are often those without homes to begin with. And so often they'll come because whatever home they did have or tent that they had has been washed away, burned up, they're displaced. And so oftentimes the workers who are there are not trained to help them find services. And then they're up against what all social workers in all urban areas have probably experienced if they've worked in the field at all, which is there's not enough services or shelters for those that we have. And so then you have people who are not really trained to do it. And I was there and I was trying to help, but it was very, very difficult to get the last humans in the shelter who had nowhere to go, someplace to go. And I ended up spending a really large amount of time on the laws around parking in Los Angeles.
Wow.
So where can they go in their cars? And there was an organization to where you could sleep in a parking lot that was guarded at night, but it only took so many cars. And so anyway, I won't go too far down that rabbit hole, but this is what happens. You end up spending all of this time trying to figure out how to help those who already had a lot of issues plaguing them to start with, not personal issues, systemic issues, making it very difficult for them to recover in life before the disaster happened. And that's something that I know the Red Cross and others are trying to take a hold of, but that's also a government issue and that's a policy issue. And that's our place as well. And it can be really overwhelming. And even when you've made a lot of great progress with everybody else who's now left the shelter, you can spend, as we all know who've worked in the field in social work at all, on 2 or 3 clients can take up almost all of your time. And you worry long after the shelters close and the cases are closed out.
Wow. This is powerful, powerful. There's so many lessons in what you're speaking about how unprepared all of us, not just our field. I mean, we give, you certainly heard me critique some of the social work profession, but this isn't just the profession. This is America itself is clearly not prepared for this on so many levels. But what you've spoken to are so many wonderful examples of what we in social work could do that we're going to have to start paying attention to. Gary, your examples of what you're going to do as field director, as a professor, is what we all have to begin to model and start to do ourselves. It's like, it's here.
I think even if we did something simple like a simulation with students in maybe their field practicum or like when they first come into the program, to where they have to figure some of these things out with no internet and no training.
Yeah.
It helps build some
That's
empathy.
Good. That's good.
I feel like I want to say midway, because I know we came in right behind the helicopters. We didn't have any infrastructure or anything in place when we got there. But we were posting up with thumbtacks, notes about people's pets. If people were really worried, yes, they were upset if they couldn't find a family member, but they were falling apart over their family pets. Yeah. And the thing that a lot of us could do at that point was try and connect them to their pets in any way that we could. So that was another thing I spent more time on that I would have never expected to. And when they were reunited with their pets, there were actually 2 organizations I met with when we were down there that flew in and deployed just to do that, just to rescue pets, because a lot of them were left behind with their owners, whatever happened. And that was a huge mental health benefit. You could sit there and talk to them all day about it, but just get them their dog and it would resolve much faster. So things like that, where it was very basic services and just caring about what your client cared about, which was, I need to find my dog, posting little papers at the few different places you could do that to say, this is what my dog looks like. Here's my phone number. Here's a landline number where you can reach someone even out of state because my phone doesn't work. Things like that.
Wow. Gary, you have any final question before we turn it over to Kristie for your wrap up?
Yeah, no questions. I just want to thank Dr. Holmes, our colleagues, for the services they have provided to our society. I got so many nuggets from this conversation about this preparing for a disaster and doing what we can now in different levels of our homes or in our car, because you really never know where it's going to happen and when it's going to happen. So preparation is the key. And I like the fact that training, extensive training takes place for the volunteers before and after debriefing to show that those volunteers are respected and cared about. So I appreciate the services done by Red Cross, and hopefully we can expand to other agencies that take the umbrella of meeting the needs of those who are displaced and going through a disaster. So thank you.
Thank you for having me today. I know this is an issue close to my heart more than ever. So if anyone has questions, they're welcome to contact me. I think, Gary, I don't know if you can post it up here or we can put it with maybe in the transcript on the channel. Yeah, but a way for you to click and just, if you're interested in signing up for any type of services, including blood donation or deploying mental health, not mental health, it doesn't really matter. I would love to see more social workers get involved in some of the policy aspects just in their own community and connecting. You don't have to actually be volunteering for the Red Cross, but how do we connect with the Red Cross? And items, even when you just said being prepared, when you guys were talking, I was thinking, okay, our go bags are down there. I know those are at least 5 years old now. Some of them are 5 or 10 years expiration, but they're very expensive. This isn't something people can just go out and buy. A lot of these, if you just Google them, if you have a family with children, you're talking about at least $500 for some of these basic go bags. yes, you can put together your own, but it's really hard to get all the things that you need to be prepared. And then water, you do have to change out on occasion. So some of these things, along with smoke detectors and all of that, are hard things to get neighborhoods prepared for that do not have money to pay for their current groceries, much less things that might happen and that they're also going to throw away when it doesn't. So there are different ways to work around that, doing a cycle and making sure you use the water before the expiration date, then move new ones in there. But there's so many avenues to go down in this area. And I think you could probably keep students very busy problem solving for this. And I would love to see more of that in our programs, which would be relevant because a lot of things are aging out in social work right now as we know it.
Mm-hmm.
And this would be something that I think we need to reprioritize. It shouldn't just be we don't need to do a semester long program just to teach students how to think critically about disaster work. That should be infused in our curriculum. We could, of course, have some kind of, depending on how your school works, you could have a specialty in some way, but it's not necessary. There's already, and it's free. That's the other part I want to point out. You do not have to pay extra college credits in order to learn to do these things. The people who are actually very good at it already have the curriculum. So I really want to reinforce that part. There is no need for students to spend more money to learn how to do this or spend money to go volunteer.
Thank you. It's been a terrific podcast.
Yes. Thank you all for being with us on today. And we will see you soon as we discuss macro social work stories. Thank you.
Wow.